Margins are tight, access is harder, and nobody in healthcare is operating with much slack these days. Today's guest will help us unpack what is really driving the pressure on hospitals and why it matters for companies trying to work with them. So, where are the fault lines existing now in healthcare? And what should smart leaders be watching before the pressure gets worse? Stay tuned. We'll hear more on the other side. Welcome to the Russo Edge. I'm your host, Solomon Wilcots, and today we're taking a closer look at the forces putting pressure on hospitals and what they mean for companies trying to grow alongside them. Joining us is Scott Becker, founder and publisher of Becker's Healthcare. Now, Scott has a sharp view into the forces driving hospital decision making, from reimbursement and insurer behavior to access, staffing, and the broader business realities facing the system. He also brings the perspective of someone who has built businesses, invested across healthcare, and watched the system evolve from multiple angles. Most of Scott's work sits on the provider side of healthcare, where he closely follows industry trends, hospital pressures, and the business realities shaping the system. Scott, welcome to the Russo Edge. Great to have you on with us today.
Solomon, what a pleasure to visit with you. You're one of my heroes. I'm so excited to be here and a huge fan and excited to talk about healthcare and all the things we're seeing in healthcare. So thank you so much for having me.
Well, look, we thank you for taking the time. For our listeners, let's inform them a little bit who may not know some of the things that you're going to give us, such as maybe the quick version of what you do and how you found your way into healthcare.
Sure. So, Scott Becker, I'm a publisher of a set of media properties called Becker's Healthcare. At Becker's Healthcare, our core audiences are hospitals and health systems, health IT. Then we've got areas and lines around payers, around pharmacy, lots of others. We've got our big annual meeting coming up in April, where you'll have President Bush speaking, Mark Cuban speaking, Fernando Mendoza, the recent Heisman Trophy candidate, Troy Aikman. We're heavy this year on Texans and athletes as keynote speakers, but we'll also have thousands of healthcare executives there trying to get a sense of what's going on in healthcare right now, where are the opportunities, what are the challenges, and more. And just a fantastic networking event where we'll have 5,000 to 6,000 people there to visit about all things healthcare. So, Solomon, thrilled to be with you. I started Becker's Healthcare like 30 years ago, and we've grown a great team and a great audience. And
Well, you got
we love.
yeah, you have a great list of speakers and a lot of informed people who are helping our audiences have a greater understanding of what's taking place in healthcare. Now, I know you talk with leaders across the country every single day. So, what vantage point does that give you, maybe that other people are missing?
Sure. No, I think the job of sort of leading a major health system today is just it's a really complicated job. You've got relatively fixed reimbursement going up just a little bit at most. You've got expenses that are going up. You've got tremendous staffing challenges. Just there's a huge shortage of nurses and doctors in our country. We're doing a much better job on accelerating the development of nurses, but on the physician side, we're way behind. You've got the adoption of technology in different places, trying to figure out how that fits into the ecosystem, trying to leverage technology. You've got this great challenge of trying to leverage great talent and great technology to improve healthcare. I had a chance last week to sit down with the CEO of the largest not-for-profit faith-based system in the country, Common Spirit, as well as the chair of the long-term CEO of the American Hospital Association, and just constant sort of reimbursement pressures with inflation pressures, and at the same time, lots of change, but a lot that's really going great as well.
If you had to name, Scott, maybe two or three factors putting most of the pressure on hospitals today, what would they be?
Yeah, I think you've got this incredible supply demand challenge where not enough physicians to staff hospitals. So when you see throughout the country labor and delivery units closing down, and you've seen 30 or 40 of those close down in the last year, that's not because hospitals want to close those down. It's because they can't staff them well to ensure that they can do deliveries well. And that part of it, that supply and demand OB-GYN is just one small example of it, but supply and demand is throughout the country. You've got 1 million physicians or so, 350 million people in our country. The numbers increasingly don't work with an aging population. So I'd say that's one. Second, you've got the large scale efforts to adapt artificial intelligence and technology into the workflow and try and figure out how we better leverage sort of talent so that we can deliver care to the 350 million people, an aging growing population. So you've got that. That's the next thing is the implementation technology. The third thing is in healthcare, we've always talked about what they talk about as the triple aim, this concept of quality, cost, and access. And in some ways, access is more and more challenging, and really for the reason we said, supply and demand, just not enough people to take care of
Yeah.
people, and not enough people in the specialties to take care of really challenging patients. Cost is absurd. We've got to about 30,000 for a family of four for cost. Average family in America makes 70, 80,000. Those numbers just don't work. And then quality, it's very hard to keep quality up when we don't have enough access and costs are going through the roof, where there's not enough doctors. So, quality sort of bending in the wrong direction, cost not going in the right direction. And access challenging. So we look at those things, and those things are constantly in the minds of healthcare leadership. And healthcare leadership does a great job of sort of with all this noise, all these challenges, playing through it and trying to make it all work and deliver great care to our nation.
Yeah, you just talked about having access. When people, Scott, tend to think about access, they do so and they think about it in terms of where care is available. But it is also about whether patients can get to the right doctor at the right time when they need that help. So, how should leaders be thinking about access today in new ways?
Those days are really coming to an end. There's just not enough primary care to provide primary care how we did it a generation ago. The good news is there are 1 million different workarounds today and that people are starting to access. For example, if people had to go to hospitals and health systems for their primary care doctor for GLP-1s today, for the other medications that you get online, those doctors would be just swamped. So what you've got
Yes.
is more and more people are going directly to the telehealth providers on these things, and it takes a huge burden off the system that people are going outside of the traditional system to get their drugs, to get their medicals, whether GLP-1s, all kinds of other pharmaceuticals, all kinds of other care. The second thing is emergency departments again are totally packed, and we've got people moving more and more to urgent cares and other access points, just as the emergency care system just gets overwhelmed.
Yeah.
The third thing is on the specialty system, we've got this debacle because while there are substitutes for primary care physicians, not ideal. We all prefer having our primary care doctor, but people are doing a fantastic job between the mix of ChatGPT and PAs and nurse practitioners. But what you cannot replace is when you've got a rare form of cancer, it is
Mhm.
very hard to replace that and that need for the clearest, cleanest diagnosis, the clearest, cleanest care platform and planning with a PA. Just very hard to do. We're just
Yeah.
not there. And so what you
Mhm.
see is, and I'm of the age where you have more and more friends that are dying of different types of cancer, and you find that bench, even at the greatest health systems in the country, in terms of rare forms of cancer or in terms of just general oncology, it is much less deep than we'd like it to be. I mean, you're a former
Yeah.
football player.
Yeah.
It's like going into a game with one quarterback and nobody on the bench.
You don't
More and
want
more
that.
that's what you've got. You've got a
Yeah.
receiving corp that's only got two oncologists on it. You
Mm.
need four, so your quarterback's got choices.
Well, it's really good stuff. And I mean, you have some really good answers for access and some of the challenges that exist in that area. Now, from Washington, what should the industry actually be paying attention to right now? And what out there serves as a distraction that represents mostly noise?
Sure, sure. So Washington, in terms of really fixing healthcare, I think has been largely broken for a long time, and that's on the right and the left. So we're not taking shots at the Republicans, not taking
Yeah.
shots at the Democrats. On
Mhm.
the Democratic side, they often say we need coverage for all, and coverage for all, Medicare for all, is a great platitude, and I quite frankly don't disagree with it. But
Mhm.
and most of us want to see everybody have coverage in our country. But talking about coverage for all without talking about the supply problem is literally like writing a check you can't cash. On the other side of the equation, they talk about, let the free market fix it. And again, the reality is the stupidest political slogan I saw a few years ago, was get the government out of my Medicare. And the reason I say it's so stupid is, Medicare is a government program.
That's right.
Half of all healthcare today is really governmental between Medicare and Medicaid. You really
Mhm.
have a mixed system. It's not truly capitalist. It's not truly this, not truly that. The
Yep.
government is a huge part of healthcare, and it's not going to change. And so, what you see on both sides is Washington's sort of broken. They've got to focus on the real problem of how do we actually fix supply and demand. When I see a couple weeks ago, Congress grilling the payer CEOs, the payer leadership in DC, you've got really two groups, Congress and the payers, that have created a tremendous amount of healthcare inflation by pouring a
Mm,
tremendous amount of dollars through the payers. Then you've got the Congress yelling at the payers about it, but the payers are really responding to a problem that they and Congress created jointly. And
wow.
that has led to tremendous healthcare inflation as well. So
That's right.
Washington's somewhat broken on healthcare. The best CEOs that I talk to day in, day out do a tremendous job of trying to filter out the noise of Washington. You can't avoid it. And everybody's got big political arms, even at huge health systems,
That's
whether through
right.
the AHA or indirectly. But the best CEOs really do a fantastic job of focusing on, okay, how do we take care of the population we have today? How do we provide better care? How do we make sure we're doing great quality? And they're really mission focused, and they're able to filter out some of the noise because the noise is overwhelming. I mean, the amount of
Yes.
noise out there is overwhelming, and having to constantly come back and focus on what can you do and not do.
Yeah, I mean, really great answers. You shed light on some of the problems that exist in the space. So, before we get to the buying process, how are reimbursement pressures and tighter hospital economics changing the way leadership teams are really setting their priorities?
Yeah, I think systems are getting better at being intentional and
Mhm.
focused. And if I look at the old days, the old days GE, when GE was a great company, and not a
Yeah.
knock on GE, but when they were a great company, they did this really good job of periodically calling the number of vendors they worked with, and
Hmm.
being more intentional and less opportunistic. And so when I look at great leaders, they do a great job of saying, okay, we really want to improve our surgery line. So we're really going to invest money in that area. Or we really want to become great in orthopedics. So we're going to hire a bunch of orthopedics and make sure they're really well equipped for what they're doing. I mean, you see so much of the building today in health systems around oncology, orthopedics, cardiovascular, and being very intentional about whether it's a device, whether it's new pharmaceutical improvements,
Yeah.
about where they're going to target their efforts and where they're going to focus their efforts. It's much like everything. When you get a system or leadership that's willing to try every new thing, every new module, every new app, this may sound good theoretically, but it's a
Mhm.
horrible strategy. And the ones
Yeah.
that are doing really well are just very, very intentional about their supply chain. They're very intentional about their vendors and how they work with their vendors, how they
Yeah.
work with companies. They're trying to work with best in class, but not also be working with 3,000 different vendors. But I would say intentionality is a big part of it.
Wow, it's really good stuff. And when a large health system evaluates a new partner or even a product or technology, what has changed most in the buying process itself?
I think when I look at what's changed most is the at the end of the day, the sophistication of buying compared to where it was. So, for
Yeah.
example, in the old days, you're working with a single hospital that had, a buying person, and multiple might have multiple different buying people. They might have somebody buying in this service line and that service line
Yeah.
and that service line. Now, big systems are much more organized. You're going to go through a procurement system. If you're
Hmm.
selling into a system, the larger the system, the longer the process, the more
Yeah.
complicated, and so you do have, so many companies trying to build first round small, mid-sized customers and health systems versus the
Hmm.
large ones. But I think the thing that changed the most is the sort of sophistication, the complexity, the filtering, the trying to keep people out versus keep people in.
Yeah.
But and so you have to be. It's still even with all that very relationship driven. Yes, there's a lot of electronics and technology involved in buying, but still is very relationship driven. And the same thing is always,
Yeah.
people don't want to buy, even if you're a $40 billion system, you don't want 4,000 different vendors if you could avoid it. You want a handful. And so those relationships become very important. And if you want to go deep with systems, you need to have deep relationships. But I'd say the biggest thing, to go back to your question, Solomon, is the intentionality and the sophistication
Yeah.
of buying and deciding who to partner with and who you're going to work with.
So, what does a hospital leadership team need to hear now, or maybe what do they need to know from a newer or smaller company before it takes that relationship very seriously?
Yeah, I think what happens is it's a great question, and I think it's very much not too different than how it's always been. Is
Mm,
that at the end of the day, if you're a small mid-sized company, you've got to develop champions within that system that are very excited about what you're doing and really see it as a difference maker and worth making an effort to do so. And
mhm.
a lot of that is you talk about everything we do. You could do all the advertising you want. You could do all the things you want to do, but someone's got to buy into this is a solution that really makes sense for this system, and somebody in that system's really got to champion it. And at the end of the day, you million different things, but it really does still come back to is there someone at the system that's really excited about what you're doing and willing to test it, willing to talk about it, willing to look at it. And I don't think there's a lot of shortcuts. I think at the end of the day, everybody and their brother says that I have a pilot. I want, can
Yeah.
you just get me a hospital pilot this with? Hospitals don't want to pilot things free or not because it's resources and time and
Mhm.
energy. And so many people have a great idea, but you've got to have an idea that's impactful enough that people see a clear use case on, and it's got to have a champion at the system. Someone's got to see this is really of benefit to what we're doing.
So, Scott, if you were advising a smaller company trying to break into a large healthcare system today, what is the first move you would have them make? And what are some of the mistakes that you would want to kind of caution to make sure that you were able to get those things out of the way?
Sure. No, I think it's a great question. I think what happens is generally most sophisticated systems don't want to be the first at something.
Yes.
They don't want to be the first at something. So really, typically, if you're building something, you've got to get some customers, somebody that's actually using your product, your system, whatever
Mhm.
you're doing, they've got to, someone's got to be using it. And that often starts, even the hugest venture capital funds have turned to this concept of we're often going to have to start with small and mid-sized customers while you're really developing relationships at larger systems. So you have to sort of do both at the same time is get yourself in the door, get going, and be talking to large systems. The other thing is there are ultimately very few shortcuts to actual one-on-one conversations.
That proof of concept is always good, particularly when you have people you work with who can attest to it. So as you look ahead, Scott, to the near future, say the next 12 to 24 months, what should the industry be paying close attention to?
Yeah, no, I think the industry, when it depends where you're talking about, sort of the life sciences industry, the device industry, the biotech
Mhm.
industry, selling into health systems, that sort of is, they have to know their use case better than anybody else knows their use case so that they could talk about it with systems, talk about it with people. I mean, a lot of it comes down to we think the best business people really know their own business really well. So when I
Yes.
think about this, I think about like we were on the phone recently with a company that has a good product and can't quite explain their use case to a system as to why a health system really needs this product. And that's a very tough spot to be in because if you can't understand it yourself why
Yeah.
this is a great benefit, then someone buying from you is going to have a very hard time understanding why this is really useful, it really moves the needle. Then from a health system perspective, I think the health system leadership, largely in our country, is doing a tremendous job of trying to stay focused on care delivery in a very challenging and changing time. There's so much noise out of DC, so much noise out of the payers, so
Yeah.
much noise is about changes in reimbursement. But I think health system leaders are doing a remarkable job of staying focused on the core of what they do in a very challenging time.
Well, before we let you go, what area do you see maybe the most reason for optimism? Where can you point us to and say, "Wow, this is something to really get excited about"?
Yeah, I would say I'd point to a couple things. First
Mhm.
is we did this incredible job the last couple of years as a nation, not me, but the nation, of improving the acceleration of how we develop nurses and nursing talent. So we're creating 200,000 nurses a year today, or moving through the pipeline. They're starting at a year now, and that's an amazing improvement from a few years ago when we were a million short nurses. That's an amazing change. In fact, there's an article in the Wall Street Journal today or yesterday about how nursing is the new route to prosperity in the country. It's sort of the new middle class. Instead of being
Yeah.
an auto worker from a generation ago, people are nurses. But that's an amazing thing. The
That's
other
right.
thing that I think is really optimistic, and the beauty of healthcare, Solomon, is every one of us is a consumer. So we sort
Yes.
of see these changes ourselves. But in the
Hmm.
old days, if I had to go to the doctor because I wanted to get this medicine or do this or do that, now a lot of that stuff's low hanging fruit, and I'm
Mm,
either getting it on telehealth or I'm getting it from an urgent care, or I'm getting it someplace.
yeah.
And this does a huge amount to take the burden off some of the system, because the system's been
Yes.
overburdened. The ERs are overburdened, the doctors are overburdened. And then if we could translate these two things that we've done on sort of taking pressure off the system, improving nurse development, if we could get to the next step, which is actually improving the development of specialists so that we have more and more specialists dealing with the harder and harder problems, we would start to really be making progress again. And I think a lot of it's around supply demand. I think that there's a lot of this where you'd say capitalism doesn't work, but there's a lot
Yeah.
where it is working, where you're seeing so many
Mm,
of these things that are going on that are taking pressure off the system, that a year or two ago, I would have been much less optimistic that there's ways to do this, because we've got this huge growing country,
yeah.
aging country, lots of need. I mean, when you look at all the negativity, the flip side is we're the third largest country in the world after India or China, and we are decades ahead of them in actually providing care to our population. It's not that India and China aren't doing fantastic on science and
Yeah.
research and development, but in terms of actually taking care of our very large population, it's imperfect, but we're doing a
Yeah.
very good job compared to those two countries. And it's not that, but and there are lots of challenges here. But I'm optimistic that there are more and more solutions that are starting to make a difference and a dent in it, and then just having to reallocate talent and energy and the best and brightest to some of the hardest problems
Yeah.
would be a great move in the right direction.
A big thank you to Scott Becker for joining us and for sharing a clear eyed view of the pressure shaping healthcare right now, from patient access and policy, hospital economics, and what leaders really need to understand to navigate what's coming next. I'm Solomon Wilcots, and this is the Russo Edge. Thank you for joining us, everyone.